This is Bill Ayers on 95.5 PLJ. We're back with our Community Connection show, and we have not one but two guests tonight. We have Lorraine Cashin, and she is the director of the Physician Assistant Program. And we have Catherine Chiaffi, and she's the Associate Director for Public Relations for Mercy College. They're both from Mercy College. And the website for Mercy College is mercy.edu. And the phone number for Lorraine and this program that she's running is 914-674-7635. That's 914-674-7635. Welcome to Community Connections. So,
Thank you, Bill. Thank you.
Good. Let's talk a little bit about Mercy College first, and then we want to talk specifically about the mobile health vehicle. Catherine, tell us a little bit about where Mercy College is and just what you folks do that gets you to focus on this kind of service.
Well, Mercy College is a private, not-for-profit higher education institution. We have more than 90 undergraduate and graduate degree and certificate programs within 5 schools. So we offer business education, health and natural sciences, liberal arts, and social and behavioral sciences. We have 4 campuses. Our main campus is in Dobbs Ferry in Westchester County. Mm-hmm. And then we have other campuses in Yorktown Heights, the Bronx, and Manhattan. Among the programs that we offer a physician assistant program. It's one of our very popular programs. And in that program, it's very important to us that these students get firsthand experience and are out there in the community and are serving people and doing good and living up to Mercy's mission. Mercy College, our mission is consumed in service. It's said on our scale in Latin, and we take that very seriously. So it's very important for us that our students serve the community and do community service. And the mobile health van is just one way that our students keep the mission of the college alive and going. So the mobile health van is something that we're really excited about, really proud of, and Lorraine can tell you all about the good that the mobile health van is doing.
All right, Lorraine, you're on.
Okay, well, as Catherine said, Mercy College has been very supportive of all that we do in the PA program, and we're very, very grateful and thankful to have such a strong support system. So our mobile health vehicle is an initiative that has originated in the Physician Assistant Program, and it's really just to put the primary back in healthcare. We really have seen that there are a lot of health professional shortage areas and medically underserved areas in the Bronx community, which is where we're located. Mm-hmm. So we wrote for a grant, and the grant was a physician assistant training in primary care. Now, our mission statement is pretty much consistent with primary care. That's what our program is seated in.
And it's what we're missing in our society. We have lots and lots of specialists who make tons of money, but primary health care people are few and far between in lots of places, especially in the Bronx, and are not well paid for the most part. So you're trying to change that.
Absolutely, Bill. I mean, one of the barriers to healthcare has really been the fragmentation of healthcare.
Absolutely.
Where we have patients going to different specialists or just different providers where we don't have that continuity of care. Mm-hmm. And there's a lack of guidance and even sometimes education for patients to follow up. So we're trying to go back into the community and to have our students participate firsthand and to assess the community's needs and for them to learn so that they can experience, learn, and hopefully want to go into primary care. That's our number one objective.
All right, so tell us a little bit about what a physician's assistant does. This person is not a nurse and not a doctor. It's a physician's assistant. I think some people still don't know what that means.
A physician assistant is a mid-level practitioner. Mm-hmm. So a physician assistant is educated in a physician model. So they follow the medical model in their training. They finish an undergraduate degree, so it's 4 years of school, undergraduate, and then they go for anywhere between 24, 27 months, sometimes up to 36 months of didactic academic training, and then they do rotations, anywhere from 6 to 8 rotations in all areas of medicine.
Mm-hmm.
So they're exposed to all different areas of medicine. Most are now, the requisite degree is a master's degree, and they do some type of capstone project, and they go out and they practice. And they practice, their rate-limiting step at this point is the supervision of a physician.
Mm-hmm.
That stops them from practicing on their own. But, the guidelines are getting a little bit more, I would say, just where they're allowing more physician assistants to practice with one physician.
So is that the case in the mobile unit? You have a bunch of physician's assistants, and then they're supervised by at least one doctor.
Well, they're students.
Right.
The physician assistant students are on the van. We, as faculty, are all physician assistants,
mm-hmm.
and we have a medical director who's a physician.
Okay. So how is the mobile van going to work? I know of other mobile vans that operate in the city. The singer Paul Simon has been involved with one for many years, supporting it. But what about this one up in the Bronx now? This is new, right?
Yeah, this is new. Right. This is starting on Tuesday, which is something that we're very excited about. And basically, through this partnership, twice a month, Mercy College students, faculty, and staff are going to take this mobile health van to the Bathgate section of the Bronx to provide health screenings and education to members of the Sharon Baptist Head Start program and the surrounding Bronx community. So it's very exciting for our students to have this kind of contact with residents and contact with people in the community and bring what they're learning right to them. And for the members of the community, they're getting all kinds of services, which is a win-win for everybody.
So you're focusing on a Head Start program, though, right?
The Head Start is our first. The Head Start is our first partnership that we've established, and we're very excited to be starting with them. So that will be our first inaugural voyage out. So we are very excited, and we think that it's a very strong partnership.
Lorraine, what kind of services will you be providing for the kids and their families?
We'll be providing blood pressure screenings, glucose screenings, vision screenings, hearing screenings. Mm-hmm. We do something called a peak flow measurement for asthma screenings.
Asthma, big problem in the Bronx.
Big problem in the Bronx.
Right.
Yes, it is. So we'll be doing some screenings for that. We do some lead assessment screenings. Mm-hmm. We're doing some body mass index, which is really a screening for obesity. Mm-hmm. So we're doing that for adults and for children.
Well, again, the Bronx has one of the highest levels of obesity in the country, certainly in the New York City area. So you're going into an area with a tremendous amount of need. And you're going to be doing it, you said, twice a week?
We'll be doing it twice a month.
Twice a month, okay, all right. And hopefully this program can spread to other places. Is that part of the plan?
Absolutely. We're already set up for another date with Westchester Square, mm-hmm. which is also located in the Bronx, to do a community outreach there.
All right. On Community Connections tonight, we have two guests from Mercy College. Catherine Chiaffi, who is the Associate Director for Public Relations, and Lorraine Cashin. She is the Program Director for the Physician Assistance Program and is helping to direct the mobile health vehicle that's just starting this Tuesday. So it's a new deal up in the Bronx, providing services, much-needed services for people who in the Bathgate section of the Bronx. Who came up with this idea in the first place to do this?
We did in the PA program.
Okay. And what was the process? How did you move it forward? Did you get resistance, and how did you get it funded?
Well, they come out with grant announcements where you can apply for a grant.
A grant from whom?
And I'm sorry?
A grant from whom? Government?
Oh, the Human Resources and Service Administration, which
Okay.
is part of the U.S. Department of Health and Human Services.
Okay.
And they come out with announcements, and we have a tremendous grants department at Mercy College,
Mm-hmm.
and they notify us of different opportunities. And we saw that the title of the grant is Physician Assistant Training in Primary Care.
And you said, oh.
So, yeah, we said that is right up our alley, and we took it. We wrote for the grant, and the one thing was we brainstormed about a different approach. We did have to come up with something different as opposed to we knew that people were writing to just incorporate it into the classroom, which is a great idea, but we needed something a little bit different as opposed to having people come somewhere.
You wanted to go to them.
Out into the community. Yes, we wanted to go to them. People have a lot of challenges. They have a lot of barriers. They
Mhm.
have transportation issues. They have child care issues. They
Sure.
have, they're working. They have financial issues. There's all kinds of issues. So we wanted to go to them.
Now, is this something
So-
that people in the community said that they needed? Did they approach you and say, hey, we need this service?
Not in the beginning,
Okay.
but as we went out,
So you had to go in and
have been-
you had to explain the service, and then people got onto it.
yeah, they love it.
Okay. So Tuesday, what happens? You're going to start, and tell us what the start's going to be.
Well, we're going to
Tuesday.
go.
Well, go ahead, Lauren. You could explain what we're doing Tuesday. Tuesday's it's an all day pretty much event there, but Lorraine could give you more of the details.
Okay, go ahead, Lorraine.
Tuesday, we're doing an actual ribbon cutting ceremony because it will be the inaugural launch of the
Mhm.
mobile health vehicle. So we're going to have our students come up to Bathgate and East Tremont Avenue, where we're going to have the vehicle. And we're going to have our full faculty. We're going to have all our students, and we're going to have a ribbon cutting ceremony.
Mhm.
We're going to have the faculty from Head Start, and we're going to start doing, as soon as we do our ribbon cutting ceremony, we're going to be welcoming everybody onto the mobile health vehicle and start our services.
Now, how big is the vehicle? How many people can you cover at the same time?
The vehicle's 31 feet. We have 5 workstations within the vehicle itself.
Ah, and each one
we
does a
can
separate kind of testing. Is that the idea?
We can have it set up multiple ways.
Mm-hmm.
So we can have it for that first day. We're going to have each station doing the 4 or 5 different testing
Right.
at each station, so we can.
All right. Now, so okay, you do testing of kids, Lorraine, and you find out in some instances that there are severe problems. It might be a hearing problem. It might be obesity. It might be lead poisoning, asthma, whatever it is. What's the process then? It's great for you to do the studies, the tests, but how do you then connect people to services to help them?
Okay, well, that's a great question also. There's 2 things. We are very heavy in education.
Mm-hmm.
So the first thing we do in terms of obesity or a problem such as that is we would do a lot of education on obesity. We also have a large database, which we have collected since the inception of this project, of healthcare providers, which has been stratified by zip codes in the areas that we go to. We have vetted all the providers to find out if they would take new patients and if they would indeed take these patients with Medicaid or no insurance at all.
Oh, that's great. So you have a number of doctors who actually will help these kids.
Yes, we do.
All right.
We have a large database, so we will be doing referrals
Mm-hmm.
and, hoping to start with creating relationships.
Yeah, that's what it's all about. Our guest tonight on Community Connections, Catherine Chiaffi, who is the Associate Director for Public Relations for Mercy College, and Lorraine Cashin, who is the Program Director for the Physician Assistance Program, and also the Mobile Health Vehicle. The Mobile Health Vehicle is starting on Tuesday up in the Bronx in the Bathgate section, And they're going to be doing lots of things to help kids. But you're also going to be working, I assume, with the parents. How are you going to do that?
Well, I think the great part about this mobile health van, among the many things, is that it breaks down barriers. So if someone's bringing in their child, you're bringing them into a comfortable zone. They're coming in for their child, and once they're there for their child, you could also offer a screening service to them as well. And the big part of this van is teaching students, obviously, how to speak to people, how to relate to people, to bring them the healthcare services, but also to show people in the community, whoever they might be, that these services are there and they are accessible, and it can be comfortable and it can be okay to sort of approach and take your healthcare into your own hands.
Well, see, I think, Lorraine, this notion of referrals, doing the testing, but then having this database of doctors to refer people to, I think that's a great service, because lots of folks who live any place, but especially in the Bronx, kind of assume that they can't afford it, or that it's too far away, or that nobody will care about them. And so I think you're going to be breaking down lots of barriers here.
I hope so. That is definitely one of our goals. We really are striving to be able to make a difference in the community and to definitely make it easier access.
Now, suppose people don't have health care. Are you equipped to be able to help the families to sign up for Medicaid?
Yes, we are equipped to begin to educate them to find out if they are eligible, what the eligibility requirements are. As you know, they are changing.
Yes.
So we are providing different days that we are going to be going to have stations that will be there to have people, just even to help them fill out the paperwork. Some people, it's just very daunting, that task. And even to understand whether or not you're eligible.
Yeah, I think that's a great thing, because, I think that the healthcare initiative that the president has undertaken is very much needed, but it's complicated, and there are lots of pieces to it. And so it's going to be successful if folks like you can take people through the process, as complicated and sometimes painful as that might be, because in the end, they're going to get health care, and better health care than they've ever had before. But getting there is a challenge. So you recognize that, and you folks are going to be equipped to help people to get to the other side, so that if they don't have health insurance, they can get it.
Right.
Right, and that's something that that Mercy College has been doing for quite some time now, that education component about the health care. We had a health and wellness expo a few months ago at our Bronx campus, and there was a whole area of the health and wellness expo dedicated to helping people fill out the paperwork, figure out, sort of navigate the whole process. So that's something that we've been committed to and will continue to be committed to as well.
All right, one of the things that I think is enormously important here is nutrition, and I'm sure you do as well. I run an organization, Why Hunger, that is doing lots of work with the federal government, with the Department of Agriculture, on the summer feeding program. So I would ask you to be very conscious of kids not eating well during the summertime. And there is a federal, because obviously they're not getting school lunch, they're not getting school breakfast, but there is a summer feeding program. And in New York City, it's all over the place. But it doesn't reach the proportion of kids that are necessary. About 3/4 of the kids in New York City do not get that. So we're trying to change that. And part of what we're doing is getting lists of the spots where there is a summer feeding program. So I think it's going to be very important for you folks to be able to tip off parents where they can get a summer meal for their children, because in many cases it's not happening. Have you thought about that?
Well, we are all about health education and education in general.
Mm-hmm.
So anything, that we could, any way that we could help sort of spread the word about how people can take control of their health and move to a better spot in their health sort of journey, we support. So it's something that we would definitely want to learn more about. Absolutely.
And the other thing, of course, is that there have been several rounds of budget cuts for the SNAP program, Supplemental Nutrition Assistance Program, replace food stamps. It's a great program. It's grown enormously because of the Great Recession that we've had, and it's been responsible for preventing massive hunger in this country. So there have been budget cuts, and about $5 billion was cut out of it in November. And now $8.5 billion have been, over the course of 10 years, has been cut. And it targets, the second round, targets families in the Northeast, and specifically in New York. So there are a tremendous number of families, especially families with a senior in it, who will be cut back on SNAP. And that means that they won't have, they'll be, on an average, they'll lose about $90 a month. That may not seem like a lot of money to some people listening, but it sure is if you're poor. So, again, that's something I think to keep in mind as you get into the community. I suspect you're going to find that there is a lot more hunger than perhaps you knew, and there is a possibility of getting people signed up for the SNAP program, and if they are one of a family that's being cut, the approximate $90, then they need to be tipped off where there's additional food. So again, just another piece of the puzzle here. So you're doing this program. How long is it for? Does it have some longevity, or is it just a short program?
Well, we're funded until the year 2016.
Okay. So
that's when we're government funded until.
All right. So is there a provision that if you guys do a good job, that you can get this renewed? Has HHS thought that through yet?
Well,
we're looking. I'm sorry, Catherine.
Go ahead, Catherine.
No, it's okay. Go ahead.
Well, what we look for is that hopefully the success will speak for itself, and we anticipate that we will continue to get college support. Mm-hmm. We also expect to have community partnerships in place that will help to sustain the Mobile Health Vehicle Initiative. We also have some businesses that we are starting to partner with. And hopefully, again, these combined efforts will help to sustain us.
I think that's a very, very important notion that you're getting to here, because it's one thing to have federal funding. That's a great thing, and I'm glad that the federal government is doing that. They ought to be doing more of it in neighborhoods like the Bronx. But I know from some of the hunger stuff that we're involved with USDA, when the government gives that kind of an award, they don't usually intend it to be forever. So having it for a few years, and hopefully they'll renew it, but it also then gives you a chance to, as you say, build partnerships. I think that's one of the best things that you can do, to have all sorts of partnerships, businesses, educational institutions, churches, temples, whatever it may be. If you have good partnerships in the community, your program will go beyond the short period of time it's being funded by the federal government. So I want to thank our two guests once again, and to give you their phone number. The number to reach Lorraine Cashin is 914-674-7635 if you want to know more about this program, or if you want to know more about the physician assistant program that she runs. And you can also go to mercy.edu to find out more about Mercy College and all of the work that they're doing in the physician assistant program. Thank you, Catherine. Thank you, Lorraine.
Thank you.
And good luck.
Thank you.
Thank you.
Okay. Till the next time, this is Bill Ayers, and I wish you much peace and love and hope. That's something we all need a lot of.
WPLJ and WPLJ HD1, New York, a Cumulus station.